Hi guys, I'm Sienna Susko, and I'm going to be telling you about the prion diseases today. This group of diseases is very unique. They're known as transmissible spongiform encephalopathies, or TSEs, because they're caused by the bovine spongiform encephalopathy agent, which is known as a prion. And I apologize in advance because encephalopathy is just messing me up with pronunciation, but I'm going to give it my best go. So the diseases that we'll be talking about today are variant Creutzfeldt-Jakob disease, otherwise known as VCJD, Kuru, and Gerstmann-Straussler-Scheinker syndrome. I had to look up how to pronounce all of those. So here we go. So what is a prion? Well, prions are the causative agent behind all of the diseases that we will talk about today. The most famous prion disease is actually mad cow disease. But basically, prions are naturally occurring proteins that make up tissues in our brains. So we have them in all of our bodies. But prion diseases occur when these proteins become folded, which mutates them into contagious pathogens that then affect other prions around it. They clump together and then they eat holes in and around the neurons of the brain, which causes it to shrink and take up that sponge-like appearance that we all think of when we think of mad cow disease. You know, it's porous with holes in it, and this eventually leads to death. So the scariest things about prions is that we don't know exactly how they interact with each other because they're just proteins. They're not living things. They're not supposed to be able to infect each other. Also, they are particularly troubling because they cannot be killed. They are indestructible. The only known way to actually sterilize them is by heating them at degrees that exceed 900 degrees Fahrenheit for hours, or straight up combustion. Yes, I mean like literally exploding them, setting them on fire type combustion. That is the only reliable way to get rid of them, so they're pretty terrifying. So think of one single prion as basically being a zombie riding a giant cockroach wielding a weaponized Nokia phone. That is the level of indestructible opponent that your brain is facing, and that's just one prion. So this is the structure of a prion. Normally, they're supposed to look like the blue picture in the middle. This is a normal prion protein. But when they become mutated, they start looking like this angry pink spaghetti over here. And this is what is the infectious particle that is the misfolded prion. This is what's so dangerous to us. So the prion mechanism is actually, prions are their own mechanism. Just as they are the causative agent behind every disease that we're going to talk about today, they're also the mechanism behind each of these diseases. So they're their own unique category, and they do share qualities associated with other categories such as contagious pathogens and genetic diseases. But they behave uniquely from other pathogens because they're protein-only infectious diseases. They're not a bacteria, they're not a virus, they're not a fungi, they're not an autoimmune disease, and they're really technically not genetic disorders. However, certain prion diseases can be passed to offspring by an infected parent, and just like genetic diseases, each offspring then has a 50% chance of inheriting the mutation and developing the disease one day. So the first disease we're going to talk about is VCJD. Just like every other prion disease, this works by basically spongifying the brain. We see those big porous holes because of the prions clump together and they eat away at the neurons. So we also see shrinking of the brain. It primarily degrades the cerebellum, which is the motor control center, and also the cerebral cortex, which is why we see dementia associated with this disease. So the symptoms of VCJD they're very similar. Okay, so actually all prion diseases can sometimes be misdiagnosed as Parkinson's because they are quite Parkinson's-like, and they are also stroke-like. One characteristic I should share now about all of the prion diseases is that they kind of make you look like you're dancing. We'll talk more about those symptoms that cause those tremors, but yeah, they do definitely make you shake a lot, and that's the big overarching factor of all of these diseases. But early symptoms of VCJD in particular are failing memory, visual disturbances that later lead to blindness, changes in behavior such as anxiety and depression, and a lack of coordination. But as the disease progresses, the patient will begin to display difficulty speaking. They'll have odd spastic movements, weakness in their limbs, that blindness we talked about. Then they'll start to see involuntary movements they can't even control, mental deterioration, and sadly, the loss of their ability to actually think, to remember, and even recognize their loved ones. And usually they fall into a coma around 6 months after the initial onset of their symptoms. Sudden death can occur, but it's usually after they fall into their coma. Most people die within 1 year of the onset of their initial symptoms. And the median age of death for this disease is 28 years old. VCJD diagnosis. So the first thing I want to mention is that most prion diseases cannot actually truly be diagnosed without the analysis of brain tissue that is obtained from biopsy or autopsy. But we can still use brain scans such as MRIs to show changes in the brain, which you can see in the top picture, the black one, that we see a normal MRI scan on the left and a VCJD MRI scan on the right. We can see, just like any positive case of prion disease would show, that the brain is shrunken and displays those spongy-like holes. Also, a histology test of brain tissue would show the amyloid and florid or daisy-like plaques that we can see, which in the top pink picture, we can see the shape of that sort of floral shape there, right over the word florid. That is one of those plaques, and then compared to the normal brain tissue is supposed to be quite clean. But the most effective form of diagnosing this disease is a brain scan called an EEG, or an electroencephalogram, and it is used to differentiate between standard CJD and variant CJD because the electrical abnormalities are different. So as I just mentioned, VCJD is actually a subtype of a disease known as CJD, which is way more common. But VCJD, the biggest difference is actually that it happens to people a lot earlier in their lives. They usually die around 28 years old, where CJD people usually die around 68 is actually the median age of death for that disease. So that's one big way that VCJD is diagnosed. In addition, so probable cases can be diagnosed by using clinical criteria. You can check for family history, as there is a strain of this that is actually hereditary. But memory exams are used to test for dementia, and motor function tests are a pretty big part of this. In these motor function exams, probable cases would display at least 2 of the following symptoms. So they would show poor coordination, like really poor coordination, myoclonus, which is spasmodic, jerky contractions of large muscle groups, chorea, which I included an actual chorea gif on the side here. This is actually someone who has this disease. This is not a joke. This is why they look like they're dancing. And actually, the word chorea comes from the Greek word meaning to dance. Another symptom that would be displayed in a motor function test is hyperflexia, which is the overreactive or overresponsive reflexes. And the biggest way that this disease is diagnosed is actually through the rapid progression of its symptoms. So it definitely shares a lot of symptoms with Parkinson's disease, especially, but you wouldn't see Parkinson's in a 28-year-old kid. And additionally, Parkinson's can take 10 years or so to really start to affect somebody, where this, you're dead in a year with VCJD. Actually, there is one new form of a way to diagnose this, and that is through cerebrospinal fluid-based tests, which in 2015, the National Prion Disease Pathology Surveillance Center began using a new test called the second generation real-time quaking-induced conversion. And this actually can detect the pathogenic prions proteins that are in the cerebrospinal fluid of patients with VCJD and other forms of human prion diseases. VCJD epidemiology. So originally, CJD had, they had already discovered that, but the variant form of this disease was not observed until 1996 in the UK. There are 3 types of CJD and VCJD that are known. The first one is sporadic. This develops for no known reason. No one knows why it happens. There are no risk factors involved with it, and it actually accounts for the most incidence of this disease. It accounts for 85 to 90% of all known cases. Then there's the familial type, this is hereditary, and it can be genetically tested for the mutation, which would be on the PRMP gene and changes in chromosome number 20, which is the gene that codes for the prion protein. And this has the same median death age of VCJD, which is 28. This accounts for 10% of all cases. And then there is the acquired, which this is transmitted by exposure to infected nervous system, brain tissue, lymphoid tissues, or even pituitary hormones. And this can be done through medical procedures that include blood transfusions, neurosurgeries performed with contaminated equipment, cornea transplants, and the final way that you can actually get this disease through transmission is eating the meat from cattle that is infected with bovine spongiform encephalopathy. And this accounts for less than 1% of cases. But I should mention that it's a little hard to trace because, through transmission, especially by consumption, the incubation period is about a decade, so a little hard to trace there. But the good news is that it cannot be transmitted person to person, and it cannot be transmitted through casual nor sexual contact. The incidence of this disease is extremely rare. Since being discovered in 1996, there have only been 232 cases of VCJD in the entire world as of 2020. The distribution for this, it has been reported from 12 different countries, and that includes Ireland, France, Spain, the Netherlands, Portugal, Italy, Japan, Taiwan, Saudi Arabia, and even Canada. But most of the cases happened in the UK. As of 2018, only 4 cases total have been reported from the United States, and it's actually believed that these patients contracted it from other countries. So, prevention measures for VCJD. To prevent it from entering the food supply, countries have enacted laws that require the culling of infected animals. There are better testing and tracking methods for cattle health. There are now restrictions placed on animal feed as well as what parts of the cow can be processed for foods. And the most effective law that was enacted was actually in the UK, and it is called the OTM rule, which means the over 30 months rule. This requires the animal to be over the age of 30 months before it can be used in human food supply. Since this disease can also be transmitted through medical equipment, hospitals and medical institutions have taken up a few changes to make sure that this doesn't happen. This includes using only synthetic human growth hormone because pituitary glands can be infected. Also, they destroy their surgical equipment that has been used on brain tissue and nervous tissue of suspected or known VCJD patients, and they do this through literally combusting them, as we talked about, because prions are almost impossible to kill. And they use single-use spinal taps for all lumbar punctures now, as well as there is a screening for family, medical, and travel history before making a blood donation. Treatment of VCJD. Like many prion diseases, there's really no treatment that can slow or stop the progression of this disease. The best we can really do right now is just make people comfortable and try to manage the symptoms as they appear. So this can include the use of antidepressants to manage anxiety and depression, and anti-seizure medications such as clonazepam and sodium valproate, which treat the bodily spasms Next, we're going to talk about Kuru, which was actually the first discovered human prion disease. We already know its causative agent is prions, as well as its mechanism. Some fun facts for you, though. Kuru was the first infectious neurodegenerative disease ever discovered, and its discovery actually resulted in the creation of the entire category of prion diseases. It's also the first disease to ever be classified as a TSE, and the word kuru means to shiver or to tremble in fear. Kuru symptoms. Unlike other prion diseases, there's little to no dementia associated with Kuru because it really only affects the cerebellum, the motor control center of the brain. So this disease comes on in 3 stages. The first stage is the prodromal, meaning that it's about to begin. Symptoms include joint pain, headaches, abdominal pain, and weight loss. But once Kuru sets in further, an unsteady gait will become normal for the patient. They will also begin to experience tremors and to slur their speech. The secondary stage is called the sedentary stage, which is characterized by the loss of their ability to walk. Symptoms also include severe coordination problems, mood changes, more frequent tremors, and muscle jerks. And even compulsive laughter was recorded in the first people who witnessed this disease when it was first being studied in the 4 people of New Guinea. The third stage is they lose the ability to take care of themselves in any way. They lose the ability to eat, actually, so they experience problems swallowing, just like with Parkinson's, and this leads to their inability to eat. Usually they fall into a coma around 6 to 12 months in, and they usually die right after this. So about a year after the initial symptom onset. Kuru can be diagnosed through neurological exams that look into your medical history, your neurological function, and blood tests. They test your thyroid, folic acid level, liver and kidney function, basically just to rule out any other cause for your symptoms. But EEGs are probably the most reliable way to test this because they test the electrical activity in the brain. So you would see that it was spongy and shrinking. EEGs would actually display the same florid plaques seen in VCJD brains. And the MRI is really not super helpful just because Kuru brains would appear like many other prion diseases, so it'd be hard to tell that it was specifically Kuru. Unfortunately, people usually die within a year of their symptom onset with this disease. But the good news is that the incubation period can be up to, decades, like up to 30 years. Kuru epidemiology. This disease is believed to have originated in the highlands of New Guinea around the year 1900, but the first case of it wasn't officially documented until the 1950s. The primary infected population was the Fore people of New Guinea, and this is due to their practice of endocannibalism, which is the ritualistic eating of their deceased relatives as part of a funeral rite. So when I say that the body was eaten, I mean nothing was left uneaten except for the gallbladder because of its apparent bitterness. They were actually prepared and eaten with leafy greens like a salad. Kuru is transmissible through eating the infected brain of a Kuru victim, and it is also contractable through contact with an open wound of a Kuru victim. It cannot, however, be transmitted through casual or sexual contact. Thankfully, this disease was mainly confined to Papua New Guinea. There's never been any reports of it happening anywhere else. I really checked into that one too, because I was like, what? No way, it's only in this one place, but yeah, their cannibalism was really the cause for this one particular type of prion disease. It had its highest prevalence in the 1950s to the 1960s, until the government outlawed the practice of cannibalism. But in the late 1950s, about 200 people each year died from Kuru. There are over 2,700 Kuru-related deaths between the years of 1957 and 2004 in New Guinea. Thankfully, this disease is thought to be extinct now, But because of the incredibly long incubation period, new cases have popped up in the last few decades. The last Kuru-related death happened in 2005. Just like every other prion disease, there's no known treatment and there's no cure. But the scary part is that brains taken to be studied from New Guinea, from Kuru patients, they can actually remain contagious even when they're kept in formaldehyde. They can still remain contagious for years afterwards. So it's important to really prevent yourself from getting this, and that would pretty much just entail avoiding the open wounds of Kuru patients, and seriously, just don't eat other people. Don't be this guy. The third disease we're going to talk about is GSS syndrome. We know its causative agent and its mechanism. This disease works by progressively degrading the cerebellum, although there are also associated varying degrees of dementia with this disease. GSS is actually the slowest and most diverse of all the prion diseases because it usually lasts from around 2 to 10 years before somebody dies after the onset of their symptoms. And it has the most variance among its symptoms. So the symptoms of GSS usually begin to hit you between ages 35 and 50, and they have the greatest variance. This can include weakness in legs, poor reflexes, abnormal sensations, progressive ataxia, meaning clumsiness, unsteadiness, difficulty walking, cognitive changes such as anxiety and depression, slurred speech, varying degrees of dementia and cognitive confusion. This leads to the slowness of their thought processing, spasticity, and the patient will also experience a progressive difficulty swallowing, very similar to Parkinson's. Also, deafness and visual disturbances that lead to blindness can also occur. So diagnosing GSS, this is actually one of the only prion diseases that can be definitively diagnosed without the use of biopsy or autopsy. GSS has a genetic marker on the PRMP gene that can successfully be tested for, so hereditary tests can identify this disease. Brain scans and nervous system findings are also viable, so if one is performed, amyloid plaques would be seen, as well as the classic porous appearance of the brain. Because this disease can occur spontaneously, yes, I should mention, this can just happen spontaneously through genetic mutation. It is extremely rare, and because of this fact, it's also recommended for doctors to diagnose this disease if they see patients that experience progressive ataxia as well as PRP plaques in their histological findings. So I found a little picture of GSS histological findings, including those PRP plaques, and it's the second one from the left. GSS epidemiology. So GSS syndrome was first discovered in Vienna in 1936. It has one of the rarest cases of incidence because it's only seen in 30 families worldwide. It's not known how many people in the world have ever had this disease or have it now because of the spontaneous generation that can happen of it. But the estimate is 1 in 100 million people. The distribution of the families known to carry the genetic marker for it reside in the Americas, Europe, and even as far away as Japan. So when this disease is seen, it is almost always through genetic inheritance, which allows for it to be categorized as a genetic disease as well as a prion disease. Offspring of an affected parent have a 50% chance of one day developing GSS. It's not known to be transmissible through blood or open wounds like the other prion diseases that we've talked about. The only real way to prevent it, though, is to adopt a child if you want to have kids and you know that you have this disease. There's also no way to prevent spontaneous development of GSS because it's the result of an uncontrollable gene mutation that occurs in the sex cells. So, but because of that, you wouldn't have any family members that have it. It would just be you. And yes, those people who develop it spontaneously do have a 50% chance of giving it to their offspring. so they should be careful as well. There's no known treatment or cure for GSS, but you can treat its symptoms, and they basically share the same medications that are used to manage VCJD symptoms. In conclusion, I included all of my references, and I just wanted to say thank you guys so much for listening. I hope you enjoyed it. There's not much known about prion diseases, but I wanted to end with a little bit of good news, because right now there's research being done in the medical field to see if there's any link between prions and more common threats like Parkinson's and Alzheimer's. And if in the future a link can be established, hopefully one day we'll have the means to cure all of those diseases.